Good afternoon, everyone. This is Saro Arakinas, your clinical pharmacist. So a lot of questions comes to me about classes of diuretics. In this video, I just want to go over the basic classes of diuretics that we have, mainly 5 classes of diuretics and examples of each of these diuretics. So here are the 5 classes of diuretics that we have. Loop diuretics, thiazide diuretics, carbonic anhydrase inhibitors, potassium sparing diuretics, and osmotic diuretics. So loop diuretics. Loop diuretics work on loop of Henle. They're available in IV or PO by mouth options. Sometimes they may cause ototoxicity or hypokalemia, which is low potassium levels. Examples of loop diuretics include furosemide, bumetanide, torsemide, and ethacrynic acid. These are the loop diuretics. Thiazide diuretics as group 2. They're mostly in PO options by mouth. They can prolong QT prolongation, so that's something to watch out for. They inhibit the sodium chloride reabsorption in the distal convoluted tubules. Examples of thiazide diuretics, hydrochlorothiazide and chlortalidone. Chlortalidone being the longer acting can be taken once a day instead of hydrochlorothiazide, which is a couple of times a day as a diuretic. The third class, carbonic anhydrase inhibitors. These diuretics decrease the sodium and bicarbonate reabsorption in the proximal tubule. One of the examples for carbonic anhydrase inhibitors is acetazolamide. The fourth group is potassium-sparing diuretics, which can cause hyperkalemia, which is higher potassium levels. These are potassium-sparing diuretics, as the name says, increases the nephron reabsorption of the potassium by interrupting the sodium reabsorption in the collecting ducts. Some of the examples of this class is spironolactone, amiloride, and triamterene. The last class, the fifth class that I want to mention over here is osmotic diuretics. These diuretics increase the urinary flow by osmotic retention of the water throughout the nephrons. The best example for this class for osmotic diuretics is mannitol, which again is available in IV in many acute facilities, hospitals. They have this osmotic diuretic and specifically mannitol. So loop diuretics, thiazide diuretics, carbonic anhydrase inhibitors, potassium sparings, and osmotic diuretics. Loop diuretics, furosemide, bumetanide, torsemide, and ethacrynic acid. Thiazide diuretics, hydrochlorothiazide, chlortalidone. Carbonic anhydrase inhibitors, acetazolamide. Potassium sparing diuretics, spironolactone, amiloride, and triamterene. And lastly, osmotic diuretics, mannitol. For more detailed information on these drugs or questions you may have on these diuretics and how they work, make sure to comment on the video with your questions, and I'll be happy to answer any questions you may have on classes of diuretics. Hope you enjoyed this video. As always, stay safe and take your medications.